My first experience with neurodegenerative disease was when I was only 8 years old. My grandfather had what we thought at the time was Alzheimer's. Now this was tragic, but not so abnormal. But what would happen to my father's generation after my grandfather passed was alarming. And I didn't realize it. It would take me decades. But it set me on the path to fight the stigma that surrounds hereditary disease. I'll take you on that journey now. As my family was flying across the country to attend my grandfather's memorial service, my Uncle Bill received a phone call. He'd been trying to understand why he was slurring his words and having trouble speaking, and now just days before attending his father's funeral, he received a diagnosis. It was ALS, Lou Gehrig's disease. ALS, or amyotrophic lateral sclerosis, is a fatal neurodegenerative disease which causes patients to lose the ability to control their muscles, leading to death in only 2 or 3 years. We were mourning my grandfather and at the same time trying to hold on to every moment we had left with my uncle. I remember at the memorial service, you could already hear his voice failing as he delivered the eulogy for his father. Sadly, 2 years later, we would be doing the exact same thing for him. He was only 48 years old. The doctors told us that ALS was rare, that it was 90% sporadic, meaning that it didn't run in families, and that we wouldn't ever experience this disease or neurodegenerative disease in our lifetime. In fact, ALS is rare. Only 1 in about 300 people will develop the disease in their lifetime. But only 2 years later, we were already experiencing another neurodegenerative disease in my family. My father, Mark, was 45 when he started to experience early onset dementia. I was a teenager at the time, and I had only seen my father as the person who could take care of me. But now he was struggling to understand and live inside of social norms. He started acting impulsively and erratically. We didn't know what to do, and doctors, they couldn't give us a diagnosis. On top of it all, I was trying to go through life as a teenager, and all with a father with dementia. I remember bringing friends over and just being self-conscious, wondering what they might think. It was also around this time that I had some of the first thoughts about my own future. If my father and uncle both had a neurodegenerative disease, what might that mean for me? But without any insight from doctors and no stories on the internet that sounded like mine, I just felt alone. Things would sadly get worse as only a few years later, my Aunt Paula would be diagnosed with ALS. I remember her story so clearly. The immense financial hardship, the stress brought on her husband and young son, and the fact that she was just taken from us far too soon. I felt like a punching bag, one tragedy after the next. And then in 2016, my father experienced an extreme episode of dementia and landed in the hospital. At least with my aunt and uncle, we had a diagnosis to blame. But the doctors couldn't seem to pinpoint what was ailing my father, and therefore, our expectations for his future were unpredictable. Sadly, after 7 months of fighting for his life, we would have to say goodbye to my father in June of 2016. He was the 3rd sibling to die of a neurodegenerative disease, and we still had no insight as to whether any of the cases were linked or if I was actually at risk. I entered this point of my life with so many questions, and I never thought that any of them would be answered. So when an autopsy report came back from my father, it shocked me. It showed that my father and subsequently his siblings carried the C9orf72 genetic variant, a causative variant for ALS and/or FTD, frontotemporal dementia. That must have been what my father had. This was all a hereditary disease. For the first 28 years of my life, I lived in fear of what my future might hold, a fear not only of the unknown, but of the stigma that surrounds hereditary disease. But the time was right for action. Science and technology had laid a path before me. Genetic testing was available. I chose to go down that path, and now I've never looked back. Soon after the discovery, my wife and I made an appointment with a genetic counselor to understand exactly what it meant to be the child of a C9 carrier. We learned that there was a 50% chance that my father had unknowingly passed this variant on to me, and that if I carried it, there was a 50% chance that I might pass it on to the children my wife and I so desperately wanted. I also learned that if I carried the variant, there was a 95% chance that I would develop disease in my lifetime. But there was a silver lining. We learned that we could do what's called IVF and PGT, pre-genetic testing, to ensure that we wouldn't pass this variant on to our children. I just watched this variant decimate my father's generation, and I didn't know what it might do to mine. But that knowledge that we could affect change for future generations gave me every ounce of energy that I ever needed to go down the incredibly daunting journey of finding out my own genetic status. And so with that light guiding my way, I enrolled in a longitudinal research study to find out my genetic status. You know, if any of you find yourself at risk for a genetic variant like mine, you might wonder what doctor you could go see. Well, I'd warn you to not go see one. I did. And the neurologist said my story was incredibly sad, but I didn't have ALS, and that I should come back when I did. I would later find out that that visit left a note on my medical record that I had sought care for ALS, and I would subsequently be denied private health insurance. Genetic discrimination is real. That's why the safest place to find out your genetic status is through a longitudinal research study, because they de-identify your test results. These studies track gene carriers like myself to find some of the first disease-related changes that might affect us. We give blood, urine, spinal fluid. Yes, spinal fluid. I've now had 7 spinal taps, all to help researchers find better drug targets and biomarkers, helping both the pre-symptomatic community and those suffering from ALS today. The study I attend is called DIALS, the Dominant Inherited ALS Study. Through it, I have access to some of the leading minds working on my variant. As a child, I had nothing. This means the world. And so after 2 visits, my wife and I flew to Boston to find out my genetic results. I remember us sitting in the room the night before, our lives literally hanging in the balance of what we might find out the next day. You know, I'll never forget the look on that genetic counselor's face as she walked in the door. She said, "Daniel, I'm so sorry, but you've tested positive for the C9orf72 genetic variant." It was like everything froze. My thoughts raced back to my grandfather, my uncle, my aunt, my father. We would not escape their legacy. My wife and I roamed the streets of Boston that night, crying and confused. After the discovery, my wife was scared. She did not want me to tell the world that I carried this genetic variant. But I had felt alone for so long. And finally, I no longer had to be afraid of the unknown, but I could be empowered by the path that was before me. So, when Real Abilities and Rachel Davis asked me if I would share my family's ALS story at Carnegie Vanguard High School, only weeks after finding out my genetic status, I said, of course. I promised my wife that I wouldn't share my genetic status, and then the day of the speech came. As I shared the generational trauma that I'd experienced and the likelihood for my future to mimic it, I felt weightless, truly unburdened for the first time. The students had just seen the movie Mr. Connolly Has ALS, a truly touching film about a high school principal who sadly succumbs to the disease. They were captivated, and then they heard me. How could this young person, seemingly so full of life, live, knowing that he might face such horrors? You know, that day I felt true empathy and connection, and I made it my mission to champion the genetic ALS and FTD community. What I once hid from the world, I now knew would help change it. But I'd first need to understand what my community needed. And as I peeled back the layers, I found a deep wound. You see, I thought my story was rare. But in the genetic ALS and FTD community, being afraid, having nowhere to turn, was just the norm. There were tens of thousands of stories just like mine. The more I uncovered, the louder the call. I knew I would need to awaken not only patients, but an entire medical community who had ignored us for too long. But systemic change would not be easy, so I looked for role models to mimic. The first was ACT UP, the AIDS coalition to unleash power. They were able to reverse misconceptions and stereotypes and reveal the inadequacies of the US government's treatment of those with AIDS. And then there was Angelina Jolie. Do you all remember when she revealed she carried the BRCA variant? It empowered women across the globe to take charge of their own health. Testing numbers skyrocketed. What was feared became mainstream. Stigma was smashed. The genetic ALS and FTD community had been hidden by fear and stigma for too long. So with a fire in my gut and a model of success to follow, I engaged the patient community to start a revolution. But that would take a little bit, and my wife and I finally got around to doing IVF and PGT. We would welcome our son Kai in May of 2020, and subsequently our daughter Hannah in July of 2022. Some of the first Barvins not to be at risk of an early demise due to ALS or FTD. A miracle. It was also around this time that I quit my job to focus full-time on advocacy. And it all started with a simple Facebook post. I'd said that I was tired of the inaction and lack of resources that had been afforded our community, and I asked who's with me. 5 others stood up, and today, 4 years later, we're a nonprofit called Genetic ALS and FTD, End the Legacy. Our goal is to engage a community of hundreds of thousands in the US and millions globally who either carry or are at risk of a causative mutation for ALS or FTD. Today, we put on webinars to educate our community. We host support groups so people can share their stories and learn from one another. And we hold pharma accountable. If we develop ALS or FTD, it's too late. We've got to figure out how to prevent this. We attend conferences and write white papers to fight the stigmatization of our community. If anecdotal evidence makes its way into research, it's possible that any of our freedoms could be taken from us when an early diagnosis of dementia is given. And most recently, we helped guide and curate the first ever conference on creating clinical guidelines for the pre-symptomatic community. Our hope is that meetings with neurologists will be held before the onset of widespread symptoms, not after. In 4 years, we've engaged our community and shown that we're determined for a brighter future. But I knew the nonprofit was in good hands. So I looked for ways to bring my energy to the therapeutic arena. And I was very fortunate to meet my current employer, Coya Therapeutics. My CEO, Howard Berman, reached out to me and said, Daniel, would you help me commercialize Dr. Stanley Appel's regulatory T-cell therapy for ALS? That meant the world to me. Dr. Appel had treated my Uncle Bill in the year 2000, and even back then, he was already known as the father of ALS. Today, we're a public company on NASDAQ, backed by the discovery of Dr. Appel that all neurodegenerative disease drives inflammatory response, which eventually leads to damaging regulatory T cells. Regulatory T cells are the body's most immunomodulating cell, and when damaged, inflammation becomes a persistent condition, driving degeneration and eventually death. Coya Therapeutics is developing a biologic that on one hand increases the number and efficacy of regulatory T cells, and on the other reduces inflammation. We were able to show in a small proof of concept study that we can almost stop the progression of ALS over a year. That is a paradigm change compared to current treatments. We are hoping to do what's been done for HIV and AIDS. Take a fatal disease that kills patients in 2 to 3 years and turn it into a chronic, manageable one. Coya Therapeutics is now in discussions with the FDA to move our therapy, Coya 302, forward to a phase 2 clinical trial. And now for my holy shit moment. We just expanded our pipeline to cover FTD. We are now creating therapies for the 2 diseases that I am predisposed to get. Oh my God. My father's generation was blindsided by disease. They lacked the science and technology, and they were unable to prepare or fight. But contrast that with where we stand today. I'm actually hopeful for my future. My story may seem rare, but the ability for all of us to understand our genetic predisposition for disease is literally at your fingertips. I hope you get caught up in that revolution because knowledge is power. Now, I want to thank you all for allowing me to speak tonight because this is how we destroy stigma, by telling our stories. One more thing. As for my future, one more thing. And as for my future, I am committed to seeing my children grow up, and dedicated to ensuring that my legacy is more than the echo of a devastating disease. Thank you very much.